Hope you guys are all doing great today. My name is Zachary Burton, and I'm going to talk about the Alexander Technique. So, what is this Alexander Technique? Well, it was started by Frederick Matthias Alexander around the 1890s. Now, he was an Australian actor who began to experience chronic laryngitis whenever he performed. Now, he didn't want to have any surgery or anything like that, so the doctors really didn't know how to heal him any other way. So he began to look at himself in different mirror perspectives and noticed that we don't get a full view of how we move unless we're looking at it from an objective standpoint, like third person. He came to the conclusion that people act based on their thoughts, and their actions are the primary cause of their physical illness. Through these movements, he realized that the excess tension in his neck and body were causing his problems. Now, his program is specifically designed to recalibrate the kinesthetic sense and to bring it into line with our conscious intention. Now, in his program, the patient discovers the movements that they're performing and what they're doing wrong, because what they're doing wrong is doing harm to them, and they are trained properly to manage their pain the way Frederick would. Now, he taught his method for 25 years, and when he decided it was time, he decided to train people to teach the technique so his knowledge could live on. So, how is this practiced? Well, you take one-on-one lessons with a teacher, and you perform sitting and standing movements to analyze what postural positions you're doing incorrectly. Now, these pictures are showing our actual pictures of lessons. So, after being analyzed, a customized plan is then incorporated into your daily activities, and you attend lessons on a weekly basis for however long is needed. Could be anywhere from a month to over a year. Now, the teacher is not gonna give you any lessons without you noticing what's wrong with yourself first. So I think that's kind of cool because you get out of it with what you put into it. Now, these typical lessons last about half an hour, and they ease the tension and effort as you adjust up to your posture that is more beneficial to your health. The overall basis for these activities is to equip you to respond to your daily activities without any stress. So there are a bunch of clinical trials done with this technique, but I'm going to focus on 3. So the first one I'm going to start off with is back pain. So there was a study done, and they took 579 patients with chronic or recurrent lower back pain. 144 were randomized to physician care, 147 were assigned to massage, 144 to 6 Alexander Technique lessons, and 144 to 24 Alexander Technique lessons. Now, they used the Roland-Morse disability score to measure the people's pain. And so over time they did these, and the results showed that exercise and lessons in the Alexander Technique proved to be more effective than the massage and the doctor's prescriptions. So the patients who took 24 days of the technique actually improved the most. And the number of days with back pain was less than the other groups after it was reported after. So the second study I'm about to talk about is for respiratory muscular function. Now, this one was a little bit smaller. They took 20 people and they put 10 in a control group, then did nothing, and the 10 other people were subjected to 20 lessons of the Alexander Technique. So before, during, and after, all the subjects took spirometric testing to test their lung capacities. So the control group made no significant changes, while the group that was given 20 lessons had a 9% increase in peak expiratory flow, 6% increase in maximum voluntary ventilation, 12% increase in maximal inspiratory pressure, and a 9% increase in maximal expiratory pressure. So the third one I'm going to talk about is idiopathic Parkinson's disease. So this is pretty much Parkinson's disease where they don't know where the source of the disease comes from. So in this study, they took 93 clinical confirmed idiopathic Parkinson's disease people, and they split them into 3 groups to determine which is more of an effective treatment in aiding the disease and possibly even curing it. So the 3 groups were a 24-lesson Alexander Technique group, a massage group, and a control group that had no treatments. So the outcome measurements were calculated by the Parkinson's Disease Disability Scale, and they were calculated pre-intervention and post-intervention. And once again, the group who took the Alexander Technique lessons had the most significant results. And massage was pretty far behind, but there were also some positive results from there as well. So to apply this to daily life, I would say anyone could do it, because it's custom tailored to what your postural defects may be. He was an actor. Many actors take this for vocal things. Singers take this as well. Dancers take this for balance, and so do athletes. So, you're doing your track running, and maybe the way you stand up isn't completely straight, so your running isn't good. Well, you do this Alexander technique, and your running's going to improve. Same thing if you were to be lifting or anything like that. So I got some questions for you guys, and so I want you to go to a mirror, close your eyes, march in place for about 10 seconds, then open your eyes. Now, I would wonder if you notice an imbalance in your posture, and if so, what are you going to do to fix it? Because if your posture's not good, your blood flow is not going to be good, your emotional state's not going to be good, and it's just overall not a good time. So I think you should fix it. Now, second question is, would you ever try an Alexander technique to help fix your posture? Why or why not? And the third technique question is, what part of our daily activities contribute to back pain the most? And explain. So here are my resources, and thanks for taking the time to watch my presentation.